the Epilepsy Research Institute's Northwest Doctoral Training Centre is going to not only allow these individuals to do their research, but we're also going to make sure that we take them through quite an extensive set of training, of education, to ensure that they're equipped to contribute to the epilepsy community in the future.
And of course, most importantly, it brings the next generation of PhD students through who will focus on epilepsy research and may dedicate their careers to the most important research questions in epilepsy.
The first grouping of projects focuses on the offspring of people with epilepsy and how in some cases they may be at greater risk of having cognitive difficulties themselves, and we're investigating that following up large cohorts of children born to people with epilepsy. And secondly, we're doing some lab-based investigations to understand some of the mechanisms behind why that high risk is there.
The second group of projects is on early epilepsy. Now, cognition's impaired in early epilepsy, so we know that in patients who have had epilepsy for a long period of time, things like memory and thinking can be impaired, but we don't know what's happening in the early stages really when epilepsy is diagnosed, and how that changes over time and who's at risk. So the second group of projects will be looking at that in data that's already collected and data that the students will collect in combination with their brain imaging.
And our final group of projects is understanding decision making. You might have a treatment that treats seizures, but actually places the person with epilepsy at higher risk of cognitive difficulties, and how those decisions are made and the psychological factors that come into play. So that means that clinicians can have those conversations in a much more appropriate and useful way with people with epilepsy in the future.
And brings together clinical and laboratory research across the life course in epilepsy research, rather than working in silo in paediatric or only adult cases.
And so overall, bringing these projects together, we really hope this new Northwest Doctoral Training Centre will be able to really enhance our understanding and our application to improve cognition for people with epilepsy and their offspring.